Hi, and welcome to Unplanned, the show about cities and how they work. I'm Sam, your host, and today on Unplanned, we're going to have a wonderful discussion about a whole bunch of data around Boston and around COVID. But before we get into that, I want to remind you to subscribe to Unplanned. We're going to have tons more fascinating conversations to come. But today's conversation is going to be particularly good because we're going to get a chance to do something that really is the reason that Unplanned started. And that question was, what would happen if you shut down an entire city for a day? It's the experiment nobody ever thought they could run, and now we're actually running it. As our guests, we are thrilled to have Luc Schuster, who is the director of the Boston Indicators Project at the Boston Foundation. And joining him is Callie Clark, who is the director of policy and the co-director of the Center for Housing Data over at the Mass Housing Partnership, or SHIPS. She can correct that when we get to it. So I'm thrilled to have them both. And without further ado, let me welcome you both, Luc and Callie.
Thanks, Sam.
Thanks, Sam.
So Luc, let me start with you. As I said in the intro just there, Unplanned kind of got started because COVID happened. And all of a sudden, we had this amazing moment where we actually shut down entire cities for a day. And it sounds kind of like that's where you all started as well, was to look at Boston in particular. And I assume the region as well, but you can correct that. And you kind of took a snapshot. What can you tell us about Boston Indicators and the COVID work you've been doing?
Sure, yeah. In fact, part of the kind of origin story of the COVID Community Data Lab is the very first Zoom meeting that I was a part of when the stay-at-home orders began. And it was a meeting that Callie was a part of as well. It was a meeting to figure out what to do with the 2020 Greater Boston Housing Report Card that the Boston Foundation issues every year. And what had happened was basically by early March, the research team had completed a full first draft of the 2020 Housing Report Card that was slated to be released in June. Mm-hmm. And we were all looking at that draft with fresh eyes, saying, holy crap, the world has changed on a dime. Is this 70-page report useful and relevant anymore? And it was, I think, a sort of version of a conversation that was happening among public interest researchers across the country at the time. So much of the data-driven research we do is based on information that has a lag, 1, 2, 3 year lag. So the report was filled with, insights around housing cost burdens, but from 2019. And that story had just changed so dramatically, we were wrestling with what to do. So long story short, one of the many things we decided to pivot was to basically shelve that draft of the report entirely and focus our energy on digging up the best creative real-time data sources we could find on how the COVID crisis was affecting our community in much more real time.
Well, let's just spend a second on that before we get Callie into the conversation. So if I understand it correctly, this started with you and your housing data, and it was March, and you were all set. You were kind of doing your final read through to see where you were at with that, and then COVID happened. The data that you've got on your website, and we'll share the link to the website so people can go there and look at it because it's really amazing stuff, is much more comprehensive than simply housing stuff. Is that correct? Is that accurate?
Yeah, so Callie will be great to speak to the housing domain where we're going particularly deep, her expertise. But the broad theory is we want to do our best job tracking how the crisis is affecting our communities across as many domains as we can analyze well. And you'll see on the website, there are key domains we haven't even touched yet, and it's purely an issue of bandwidth, but we haven't done anything in education yet. What we have looked at is housing, transportation, the economy, demand for social service programs, and we've actually led with an equity analysis looking at COVID-19 spread by city and town.
What can you, and Callie, we will get to you just in a second, but what's a big takeaway? The data that is up there, and you do rightly point out there's nothing on education yet, but the stuff that's up there is very, it feels comprehensive, it feels deep, it feels like there's a lot there. What are some things you would point out to all of us who haven't spent as much time looking at that data as you and your team have?
So I'd say when we launched the project in mid-May, the story in broad strokes across most of the domains was one, kind of just like how you framed the beginning of the conversation, Sam, of a freeze. You know, we had saw MBTA ridership across all subway lines down by more than 90%. All restaurants had been entirely shut down at that point, right? So we had some interesting data that Open Table has made available to researchers, really actually worldwide, where you can compare seated dining in restaurants worldwide over the course of the pandemic. And, you know, through late March, all of April, and early May, restaurant dining was at zero because we had shut down restaurants. So there are a lot of places where in mid-March, you know, much of society had been literally shut down. It's been really interesting to track those changes over the last 2 months now, and we're seeing sort of gradual reopenings. And you can see the slower, more gradual pace of reopenings in Massachusetts, for instance, compared to the rest of the country.
Well, let's just spend a second on that. Is it, remind us, is this just Boston focused? Is this Massachusetts focused? Is this region? Where are we talking about?
We jump around geography a bit, just sometimes the data forces us to do that. For the most part, we're doing statewide, actually. And so a lot of the shorthand I'm using here is referring to sort of statewide averages. So the Open Table data is restaurant dining statewide, for instance.
All right, so Callie, let's get you into this conversation, and
Sure.
Your focus is on housing. Before we talk about anything else specific to your work, why don't you describe for us what it is you actually do so people can know and understand what you do during your day job?
Thank you. Well, thanks for having me, Sam. I'm really happy to be here with you and Luke today. So as you mentioned at the beginning, I'm the Director of Policy and the Co-Director of the Center for Housing Data at the Massachusetts Housing Partnership. And so what my team really does is we think about how to use data combined with real stories of what's happening on the ground to influence policy at the state, local, and regional level. So what does that actually mean? We produce a lot of websites like this great COVID Community Data Lab website, where hopefully we make information easy to access, to understand, and to most importantly, take with you and do something with, right? We're really focused on action. So as you mentioned before, there are a lot of websites with a lot of data out there, but how can you take that data and turn it into action at the local level?
Why don't you, before we get into the COVID specific stuff, take one step back to Mass Housing Partnership. What's their mission? What are they trying to accomplish? And how do they fit into the big picture?
Yeah, so the Massachusetts Housing Partnership, we're a quasi-state governmental agency. We've been around since 1985, and we're really focused on helping to build and keep affordable housing across the Commonwealth. So I think we've worked in over 310 municipalities across the state. We do a bunch of things. We finance affordable housing across the Commonwealth. We provide technical assistance or consulting services in municipalities who are interested in building more housing or need help to have a conversation about affordable housing. We have a first-time homebuyer program called the One Mortgage, and recently launched something called One Plus Boston, specifically focused on helping people buy their first home in the city of Boston. And then my team, where again, we focus on data and policy.
Well, let's talk about let's jump into COVID now, because you were, from what I could tell from the website, you partnered with the Boston Indicators group to do a deep dive into housing and COVID. First of all, is that correct? Is that how you and Luke have been working together on this, is my understanding?
Sure. I mean, going back to what Luke said, so my team is one of the researchers for the Greater Boston Housing Report Card. We were authors in 2019. And as Luke said, we were right there finishing things up. I remember the Friday before we went home, finishing up a section and reading it on Monday and saying, this doesn't make sense anymore. So as Luke said, we started to have conversations about how can we take some of this great data and really this partnership that we've had with the Boston Foundation and with indicators to really think about how can we be helpful in this moment where there's a lot of things have shut down, but you know, on the flip side, if you take a look at some of the, for example, social assistance information, all of a sudden the incredible need became apparent that really has always been there, but COVID really just shined a light on it. So while we shut down, also we needed to a lot of things need to open up and ramp up. So we wanted to shine a light on that.
Well, so you wanted to shine a light. So where did you go from that moment, from March, and you came back in on Monday and none of it made sense anymore because the world had changed so dramatically. What was the first place you went to in terms of your work and your thinking about the data you had and what you should do next?
Sure. The first thing for housing specifically in the housing section was we already know that we're in the middle of a housing crisis in the Commonwealth and in Greater Boston as a whole. And how is this going to be impacted? So we started thinking about what's going to start happening with rents. Are people going to, as they're losing their jobs, are people going to be able to pay their mortgages and pay rent? And just started thinking about what information exists out there. And this is where, you know, we're trying to get more granular information, but right now we have some good stuff for the state as a whole and also national information about, are people able to pay their rent? Are they working out different arrangements with landlords? So that was the first place we went. Are people going to be safe in their homes?
I'm going to
Sure.
jump in here and say, what can you give us some initial results of what you've been seeing? Are people able to pay their rent? What is going to happen on evictions? Can you begin, and I'll ask Luke in a second as well, but what are some of the stories that we think we should be paying attention to as we move forward? We're now in early July. So what's next for everybody?
Sure. So in terms of rent collections, we've actually been looking at some national data, and overall, people are able to pay some or most of their rent. So I think as of June, you know, 81% of people were able to pay their rent payment in the first month. And by the 20th of the month, 92% were up, which are actually pretty good numbers, but we know that people are making decisions on an everyday basis, whether to pay for healthcare, food, or rent. So even though the numbers look good, we know there are stories behind those numbers.
So look, yeah, no, go ahead. Sorry.
No, I was just going to say, I was going to move into evictions and foreclosures because that's
yeah.
something
Tell
that
us,
you brought up.
give us a quick snapshot of that, and then I want to ask Luke about the equity component that I know that they've looked at with the indicators numbers. What about evictions? Where are we on that?
Right. So as we know, the state really shut down in mid-March, but we didn't have an eviction and foreclosure moratorium until the end of April. So we were seeing, you know, in that month, and we have this information on our website, that evictions were happening and people were really scared. And then the moratorium goes into place, and it's in place until August 18th. Or 45 days after the state of emergency ends. So we're in this place right now that, again, you look at the numbers and there haven't been evictions. There haven't been eviction filings because we have a moratorium, but we know that there's something bubbling underneath the surface and what happens when that moratorium ends.
Yeah. So Luke, tell us about, so I know one of your, the first things that comes up on the website is about equity, COVID and equity, if I'm not mistaken. What can you tell us about that and the work you've done there? And what are some of the things that you've noticed through that equity lens?
Yeah, so that first section looks at COVID-19 positive case rates at the municipal level and compares that to a range of important socioeconomic variables to see where the strongest connections are. And I should say that's a section we produced in partnership with researchers at the UMass Donahue Institute, which has also been great partners on this work. And what we found in that section is just a really disturbing set of connections where the lowest income communities that have, the highest share of frontline workers before the crisis are also places that have seen the fastest spread of the virus. I suspect most folks following this locally know that Chelsea, for instance, has by far the highest COVID infection rate in the state. Chelsea also has among the highest shares of residents of color statewide, among the highest shares of essential frontline service workers. And I think one of the maybe very most interesting kind of innovations in the research across all the sections was an analysis we did here looking at the relationship between COVID case rates and residential overcrowding. So, there's been an understandable conversation around the future of cities in an era of coronavirus. Turns out the relationship between COVID rates and population density, just looking at people per square mile, is relatively strong, but there are a lot of dense cities that actually have not had very bad outbreaks at all. What's much more strongly correlated with COVID case rates is residential overcrowding. So the measure we looked at is residents per bedroom. And in a community like Chelsea, basically 10% of all residents of Chelsea are living in a home where there are more people than there are bedrooms in that home. So, our inability to provide adequate, safe housing region-wide, especially in some of our lower income neighborhoods of Boston and gateway cities across the region, is one of the factors that appears to be leading to worse spread of the virus.
Is this something, and this is a question to you both, because you may fit in differently into this question in terms of your organizations and the kind of work that you've been tasked with doing, but will you be generating policy proposals out of some of the data analysis that you've done? Or is the purpose to provide the data to other places and people where they can work through policy ideas and see and try to implement them? Luc, where are you in Boston Indicators? And Callie, be interested where you are with MHP.
Yeah, I actually suspect our answers will be similar to this, but we'll see. I think for the most part, I view this project, the COVID Community Data Lab, as most focused on tracking the story in real time as best we can and using it for conversations around policy. So our hope is that people will develop a greater set of insights around the dynamics day to day and then use that to inform the smartest possible policymaking conversations. Separate from this project, we are doing work on policy reforms for addressing our region's big challenges. And I'll just, in this context, pitch a really exciting project that we are going to release early this fall, which is designing and modeling a big statewide policy idea of having the state require all suburbs along the commuter rail network in Greater Boston to legalize the construction of multifamily housing. And it relates to the COVID work pretty directly because one of the findings when you look at the municipal level is the fact that in many of our high income suburbs with these really valuable transit assets going out into the region, there are almost no low and moderate income families at all. And it's because of the longstanding history of exclusionary zoning where these communities literally ban the construction of anything other than large single family homes. And so one of the key strategies, I think, for addressing residential segregation, the huge disparities in where frontline workers are living is going to have to be the state taking a more proactive role and expecting every community to contribute their fair share of middle-class housing.
That's a fascinating zoning reform. And I don't know if you put your idea under zoning reform in general is a fascinating topic, and it may be one that we get to here in Unplanned. So stay tuned for that. That's it, because it's a big one and it's been in conversation for a long time. I certainly remember it from earlier days. Callie, how about you? Where do you fit in the data versus policy generation sort of scale or equation? What is it that you and your organization will be doing with the data that you've been collecting and thinking about?
Sure. So as Luke said, for COVID Community Data Lab, I think we're just trying to put the best information out there that we can to hopefully spark conversations and educate people about, give them some hard numbers to match up with the anecdotes of what they know is either going on in their community or they're reading about in the newspaper. But beyond that, we also are thinking about how do we take this information and take all of the data that we use to spur public policy and think about moving the Commonwealth forward in terms of exclusionary zoning, land use. Specifically what we were looking at before COVID and are planning on getting back to is something similar to what Luke said, looking at development around transit-oriented development parcels across the Commonwealth. So earlier this year, actually, we launched a website called TODEX, Transit-Oriented Development Explorer. It's at mhp.net/TODEX. And we mapped every commuter rail station in the MBTA system and then looked at the parcels in a half-mile radius around to see what's actually there. So when Luke is talking about exclusionary zoning practices, we have a tool, and a lot of people have other tools too, but if you want to take a look at our tool, you can actually compare every single commuter rail station and look at the residential zoning and the density around those station areas to, I don't want to pick on anyone, but think about why maybe an inner core suburb has a certain residential density and maybe one in the 95 belt has less residential density, and what should we be doing moving forward, thinking about that.
So we have a limited number of minutes in the program and we're getting close to the end. I want to use as my wrap up a question to both of you. Callie, maybe we'll start with you on this one. What is one thing that struck you in particular about the experience that COVID kind of revealed or exposed? And it can mix in your own personal experience, maybe your work experience, but also the things you're working on. What's one thing you were surprised by, you were shocked by, you were disturbed by, you were impressed by, starting on that Monday in March when you came in and you realized this doesn't make any sense anymore. We have to rethink all of this. And Luke, you're going to get the same question, just so you know.
I just get more time to prepare for it.
Yeah, that's a tough one. I mean, I would say that one thing that I'm always impressed about and that continues to fuel my work every day is how much people actually care about their fellow Commonwealth dwellers, right? And how much people care about their neighbors and thinking about people outside their town borders, hopefully, and how much we're all trying to hopefully work towards something to make this a better Commonwealth. Something that shocked me, but kind of shame on me, shouldn't have shocked me, as we talked about before, is that even though we, again, as a Commonwealth, talk a lot about moving forward as a state, that when it kind of comes to actual action, sometimes we're not willing to do that. So looking at the COVID stuff, and as Luke mentioned before, looking at just the racial disparities and what's going on in some of our gateway cities or communities mostly full of people of color, that's shocking. And we should be ashamed. And I think it's exciting that we have this moment to hopefully right wrongs and policy wrongs that we made in the past and think about moving forward.
Luke, how about you? What's one thing you would share that surprised you, shocked you, impressed you from early March to today?
Yeah, maybe I'll try and build a bit on some of what Callie said. I was pleasantly surprised by some of the state and federal policy response that happened during the early days of the crisis. So the state's eviction and foreclosure moratorium has been tremendously helpful in pausing. It's not, ending permanently by any stretch, but pausing immediate housing suffering. And the data that Callie's been gathering in their housing section shows that really clearly. At the federal level, there have been huge issues with people left out of some of the recovery bills that have passed, but the economic impact payments of $1,200 a person have helped a lot. And that combined with expanded unemployment has helped tremendously. And in some ways, for certain types of households, we've hardly seen any economic suffering at all yet. Some low-income households, because of expanded unemployment, are actually earning more on expanded unemployment than they were working in low-wage jobs before the crisis. And that says something both about the low-wage jobs before the crisis, but also about the importance of those federal benefits. So all of that's helped, I think, in a really meaningful way. That's paired with real concern and, frankly, pessimism about the likelihood of the state and the federal government redoubling those efforts in the coming month or two. The expanded unemployment slated to end later this month. The eviction moratorium slated to end, I think, sometime in August. So we could be facing a massive policy cliff soon. And I think there's a sense that there's real suffering right now. Again, undocumented immigrants, for instance, who have not gotten those federal payments are suffering right now. But the numbers of people suffering, may explode in a few short weeks if we don't act further. And so that's, I think, the call to action.
Well, Luc and Callie, I want to thank you both for spending some time with us on Unplanned. The work you're doing is really both fascinating and fabulous in the sense of the depth of it and the ability to really dig into what is going on. And it's a wonderful snapshot, and I hope it will continue in the future, because the data and the processing you're doing is a wonderful look into our society and where we are. We are unfortunately out of time on Unplanned, so maybe we can have you back on the show at some point in the future and look back. But for now, just thank you both once again. Real pleasure having you.
Thank
Thanks,
you,
Sam.
Sam.